I'd like to introduce you to my good friend and colleague Lisa McPherson. Lisa has more than a decade of experience in the private health insurance industry. One of the things that Lisa and I do not agree upon at all is the issue of private patients in public hospitals. Would that be correct, Lisa?
Absolutely.
We do enjoy, however, debating this issue over and over and over again, just about daily in the office. Lisa, the private health insurers are complaining that an increase in the incidence of private patients in public hospitals is pushing up premiums. How much do the private health insurers pay for an average public hospital admission?
It depends on the length of the admission. At the moment, a day cost for a public hospital in New South Wales is somewhere between $800 to $1,200, depending on the type of patient.
Okay, so that fee, that on average say $1,000 cost, is for accommodation and operating theatre fees.
Yep.
Right. So separate to that are the medical costs.
Yes.
So the medical cost for, say, a consultation by a physician is an item 116, and that would be about $100. And Medicare pays 75% of that, which is $75, and the fund will pay $25 plus an additional no-gap amount. So the total amount that the fund pays for the doctor's fees is probably about $50. If it's surgery, they pay nothing post-operatively because that's all aftercare and can't be claimed. So is it correct to say that the ratio of the hospital cost as opposed to the medical cost is something like $1,000 to $50? It's like 5% perhaps.
Perhaps, yep.
Okay. And isn't that exactly where Bupa is targeting at the moment?
That is where Bupa is targeting.
And do you see, why do you think they're doing that?
My guess would be to reduce the attractiveness of going to a public hospital as a private patient, not really to address the cost of the medical fees, but to save the $1,000 they're paying the public hospital.
But would they still not have to pay that $1,000 for the bed?
Potentially, if it's less attractive for you because you're now going to have an out-of-pocket, you choose to be treated as a public patient instead of a private one.
But if I've understood correctly, a private patient in a public hospital, the Bupa will still have to pay $1,000, and what they're actually doing is saying, but we're not going to pay $50 to enable you to see your doctor of choice.
Mm-hmm.
Thank you.